I'm Dr. Rita Bakshi, Chairperson of International Fertility Center at Green Park, New Delhi. What is primary infertility? First, what is infertility? When a couple has been together for 12 months, unprotected intercourse, really knows the timing, still not conceived, we call it primary infertility. Or primary infertility also means there is no pregnancy happening at all. While secondary means pregnancy has occurred and then one is not really able to give a good baby. So a primary infertility means one has not ever become pregnant. What other causes for primary infertility? Now it is important to understand fertility as a whole, to understand what is primary infertility. But more important than that, for people who have never conceived, is to know that they are genetically normal, anatomically normal. It's important to know that they are genetic females, that means there is a 46XX chromosome and there is not any deviation in her chromosomal pattern. What is really, you will see cases of what we call it as Mayer-Rokitansky-Kuster-Hauser syndrome, in which there is a girl with secondary sexual characters, plus there are ovaries but there is no uterus inside. The uterus are just small, two small blebs, nothing really inside. So this is important to rule out when we are dealing with primary infertility. We make sure we do a good ultrasound, make sure that there is nothing wrong, that all are anatomically organs are in place, genetically she is normal, and then we look at each and every organ in detail. That means why she has not conceived. Is there something wrong in her vagina or in the cervix? Is there some infections which are not allowing the sperm to reach the egg? Is there are antibodies being produced in the sperms which are called anti-sperm antibodies, which are killing the sperm on the way? Is the uterus lining forming good enough for the pregnancy to implant? That means, is it thick enough or is it very thin? Or are there any adhesions in the cavity which are preventing the embryo to implant there? Is anything preventing the sperm to reach the egg because of obstruction in the tubes? Is the cornwall end open for the sperm to reach the egg in the tube? Again, is the fimbral end open for the egg to come in the middle of the tube or not? So it's important to see the tubal patency. Then we look at the ovaries. Is everything all right? Are there enough eggs in the ovaries? Are they coming out normally on the right date? That means around mid-cycle. That means around 14 days post-menstrual or 14 days before her next menstrual cycle. So is it a good egg coming out? Is it a polycystic ovary? Or what we want is one good egg to come out of the ovary every month, to be picked up by the tube, and then for it to travel somewhere in the middle of the tube, where the sperm will also travel, where the two will meet together, form the baby. This baby will then travel into the uterine endometrium and implant. And are the hormones there to support? Is her thyroid, her prolactin all normal or not? And even if it gets implanted, sometimes you will see women will just abort. That means they'll be overdue by 3 or 4 or 5 days or a week, and then the pregnancy will not implant. That means there is something which is killing the pregnancy itself. So you work out on the antibodies, work out on the thrombophilia screen, work out and see are the thrombus or emboli being forming, which is not letting the blood flow into the embryo and it is aborting. So a primary infertility, or a woman who has never become pregnant, it is important to rule out all the causes in the female as far as female is concerned, but it's very important to rule out the male causes. So it's important to see that the male is normal. There is nothing wrong in the male. One single good semen count, if you have a good sample, there is nothing really more to see in the male. So a good semen sample, everything ruled out in a woman, one is more or less sure that in this primary infertility, there is nothing really wrong with both of them. And that's what sometimes will become unexplained. In case you have any reason to question on any of these topics regarding primary infertility, you are more than welcome to contact me anytime in the details given in the box below. Thank you.